Hello, it is so nice to meet you. I am Dr. Jessica, and I see that you are here for some cosmetic alterations. Of course. And did you have any particular questions before we get started with the consultation today? Just gonna kind of see how things go, and you can always ask questions as we go through. That is more than fine. Okay, great. So I see that your paperwork looks complete. Let me see. Yes, and I see that you have already had your psych consultation, which is a lovely thing. Dr. Blanchard. We love Dr. Blanchard. I like to recommend the vast majority of my patients to see her. She is fantastic. Okay, well, this is looking pretty good. Okay, well, I have your notations here on the things you would like adjusted. So what I'm going to do to start out with is I'm just going to take some pictures of your face as you are now, and then we will load them into the computer, and I will do a brief examination, and then we'll just play around with a little bit of mapping on your face and see what we like. Okay? Perfect. That sounds great. Okay. So first thing we're going to do is get some pictures. All right, are you ready? You don't have to smile. You can just sit there and try to relax. I know it's hard when someone's in your face with a camera, but okay. And can you lift your chin for me? Just like that. Perfect. Okay, you can put your chin back down. Just a couple more. There we go. That should be good. That wasn't that hard. Pretty painless, right? Okay. And those automatically get sent over to my tablet. Okay, perfect. It looks like everything has gone through. So we are good with the photos. Let me. Okay, so your photos look great. So what we're going to do is just roll right along into the facial examination. Is it all right with you if I touch your face and your neck? Yes. Just do a brief examination. Okay. Perfect, perfect, perfect. Thank you so much. Okay. You're being very patient. Thank you so much. All right. That looks good. Just make a couple brief notations here. Question? No? Okay. Okay, so let's see. Let me show you what I am thinking first. I'm just going to use my lovely little Q-tip here and do a little bit of light tracing. And then you tell me if you want to add more areas to be adjusted or if this is kind of what you're thinking. Yes, just going from the notations that you made and what I'm seeing with your bone structure. Okay, so we're going to start here. right there around the eye, and we'll pull that lid up a little bit. It'll just open your eye up. Go here. The nose will become a little thinner, and we'll get rid of the little bump that you don't like in it. And then little nip tuck at the chin. And you wanted your cheekbones a little bit more prominent, correct? Okay. So those are the areas that I'm looking at working on. And that sounds okay with you? It is a lot of work. Yes. Well, you did sign all of the requisite paperwork. So everything looks good in that regard. And I just want you to understand, to be fully cognizant that this is a lot of facial reconstruction. Even if it's just a little bit here and a little bit there, it kind of adds up. Well, you are perfectly lovely just the way you are, but I do understand wanting to be your best self and wanting to feel like you are putting the best you out there. I totally understand that. So I'm just going to go through and make a few mapping points, and then I'll probably take a couple pictures of that, and we will roll on towards the end of this consultation. So let me just do a little bit. Let's see, turn your head just slightly for me. Thank you. Okay, and the other way, please. Thank you so much. think that looks good. Let me grab the mirror here, and you tell me what you think. Yes. So we'll just do a little bit of an eye lift, a little bit of an uplift at the corner. Just open the eye up very nicely. And then slimming the nose, like I said, removing the little bump. You wanted your cheekbones just a little bit higher. It's still going to be you. You will still look like you, just you with a few tweaks and a few modifications to help you feel like you're a better you, if that makes any sense. Of course. Yes. And of course, on the day of the operation, we will go over all of this again. And if you want to make any changes, if you decide you don't want something done, we don't have to do it. You know, this is all up to you. All of the decisions are in your hands, and I will just be the tool that does the work. But the decisions are completely yours. I will not try to sway you in one direction or at the other. I will give you my honest medical opinion. But that's about it. Yeah, I want you to be comfortable with the decisions that you make. Of course. Okay, let me grab a few shots of your face with the markings, with the mapping. Ready? Okay. I'm going to have you turn your head just slightly that direction. Perfect. One more on this side. Great. And now we're just going to turn the other direction. Okay, and like before, just lift your chin for me slightly so I can get some good shots of your neck. Okay, you can put your chin down. Let's see. There we go. Okay. There is that. Okay, so you have already gone over all of the financial and legal paperwork with the office. Is that correct? Perfect. And then we handled all of your mapping today so that you can kind of see what things are going to, well, it's kind of hard to see what things are going to look like, but you can see the areas that we are going to focus on and where we'll be making the changes. And were you comfortable with those? Yes. I want you to be completely comfortable with this process because it is about you. Okay. Please bring someone with you to the pre-op appointment if you feel like. there's absolutely nothing wrong with having someone there to hold your hand before you go in. Okay. And we make sure those last photos came through. Yes. So I have pictures of the mapping. And since we have those pictures in, what I'm going to do real quick before I let you go, I'm going to run them through this little program I have, and it will give you a brief glimpse of what you will look like when you're done. It's not 100% because it is a computer model of your face, but I find that it gives clients just that better sense of how things will be. A lot of people have problems seeing in their mind's eye what the face will look like, or imagining what the face will look like just with the mapping lines. Okay, all right, so this will be the new you with the alterations that you are requesting. Yes. Yeah, like I said, it's still you. But it's just you with a few adjustments. And I think you will look even more beautiful than you do right now. But are you happy with it? You are? Great. No, I think that's great. Okay, would you like a printout of this to show anyone? Or are you keeping this a secret? Gonna surprise the world with your new look? You want a printout? You can always have one just for you as well. There we go. I just went ahead and did a full set of printouts with the side views and the front view for you. And those will print out at the front desk. So you can pick that up at the front desk on your way out. It was so nice to meet you. Do you have any questions for me now that we're done? You do not? Okay. Okay, that sounds great. Well, I do all of my surgeries, as I'm sure the front office told you, on Wednesdays and Fridays. And then I have a day for emergencies and then the 2 office days. But so we will see you either on a Wednesday or a Friday for your surgery. And if you have decided that you don't want any of the alterations that we have discussed, just let me know then, because we can always make some last minute changes, okay? Okay. Well, it was very lovely to meet you. Of course, if you find that you have any questions, just please feel free to give the office a call. And if the office can't answer it, they will send it back to me and I will get in touch with you, okay? Okay, great. All right, well, it was a pleasure to meet you, and I'm so happy that I can help you with this and help you feel like that better you. Okay, yeah, so I will see you next on pre-op day, okay? Sounds great. You have a wonderful rest of your day. And don't forget to pick up those pictures at the front desk. Okay. Bye.